Thank all of you for being here. This is a very exciting day for me and for the Commonwealth. And it represents, I think, what this university most values, and that is the people of the Commonwealth. It's also another day that we get to pause and think about the impact of public health. And I love days like this. You know, usually we call on our physicians and other healthcare givers to treat people one at a time. But in public health, you get to prevent and treat disease thousands at a time. The other part that's nice about this is you usually make lives better and longer when people don't even know it. In public health, you can say you're doing it while people are sleeping. It also reminds me of something my father-in-law told me once about how his father taught him what compounding interest was. He said they grew up on a farm, and his father was trying to explain it to him when he was 5 years old, and they had a new calf. And his father told him every morning after he got up to go out and pick up the calf. And he said in a short amount of time he couldn't lift the calf. That grew so fast. That's what compounding interest is. Just trying to explain it to him in financial terms. But prevention, to me, is a compounding interest story that yields life years and time. And its dividends are in the form of memories that one cherishes with family and friends. When you buy that time that you would have lost had you not prevented disease. What else I love about this story, it's about community and working with community. This isn't an idea that we here in Lexington thought was a problem. This is an idea and a concern of the communities who we get to partner with. I'm new to Kentucky, but days like today remind me that this is what we're all about, and this is what we've always been about. This is in our DNA. This is what it means to have roots as a land-grant research university dedicated to serving its people. So I want to thank Dr. Crosby and his team. This funding is another indication of our competitiveness in a national competition. People have confidence. They want to invest in us. They know the returns in terms of extending life and saving lives is one for which they should have confidence. I want to thank our community members who are here today and all of those who work shoulder to shoulder with them every day to make possible the hope represented in this grant. So thank all of you for being here. It's an exciting day, and I look forward a few years from now to seeing those wonderful data that I think reinforce extending life, improving the quality of life, which is what is most represented in a public health intervention.
It's really an honor for this to be actually my first opportunity to celebrate a research success in an area that is so sorely needed in the Commonwealth. As a researcher myself, in studying chronic diseases like obesity, diabetes, and heart disease that are rampant in rural Appalachia, cancer is one that we know that is a particular problem there. So that's, to me, why this particular program is so important and so really cutting edge in what they're going to do with the community. From what I understand in talking to the investigators of the program, this is a very tough, as we all know, federal funding climate. And to be able to renew this particular program, I think, is a real accomplishment and speaks to the importance of this particular research. And so I congratulate them on that. That's very hard to do. They also told me how hard it was to put the application together and how it pulled together so many people because of its very far-reaching expertise in what it was doing in the community. So I know what that's like. So I congratulate them and thank them for going to the effort there. This is one of our research trifectas, really, that allows us to be that way in the Kentucky Commonwealth, that makes us distinct, because we do have a research trifecta in cancer, in neurosciences, aging, and translational research. And so I join President Capilouto in congratulating this team, and I really look forward to working with you and hearing of your successes, and hopefully you can help teach me something about how to improve obesity, diabetes, and cardiovascular disease in these same populations. Thank you very much.
I'd like to thank Drs. Capilouto and Cassis for their very kind remarks. We are very excited to have this grant because it was an opportunity for rural Appalachia. We really wanted to make this work, and it did. There were so many PRCs, those are prevention research centers in the United States, that competed for this money. We knew we'd have to go all out to make this work. It was just about a year ago today, in fact, that we had the funding opportunity announcement released. And I called up the team and I said, folks, I think we need to cancel summer. And we started working, and it went in on time in late September. What this funding does, not just for rural Kentucky, but for all of rural Appalachia, is potentially creates a model that will save thousands of lives. As well, we will avoid having people go through the process of colonoscopy, because now we have new technology. Our job is not bench to bedside, which is often a medical model. Our job is from bench, meaning new discoveries, to the community. Our job is to help people see that they can use a very simple kit called a FIT kit to simply test their stool for antibodies to polyps that may exist in their colon. This is the new way to prevent colorectal cancer, because there's a forgiveness factor with this cancer. It doesn't grow quickly. So if you can find evidence that there might be something wrong, there's plenty of time to have that polyp surgically removed. If there is nothing wrong, you can skip the colonoscopy. This is the beauty of the prevention that Dr. Capilouto was talking about. We don't need to catch these late and have people wind up living the rest of their lives with only part of their colon. And this is all too common in rural Appalachia and in rural Kentucky. We can help put an end to that. We can preserve the quality of life as well as the length of life. We can save family members. So to us, that was the real eloquence and the real beauty of writing this grant. So I'm very grateful to CDC for this money, and I'm very thankful that we can do this work now in Kentucky for the next 5 years.
Thank you to everyone who's here this morning, and thank you to the previous my colleagues for their previous remarks this morning. What I'd like to talk about just briefly is the value-added nature of the Rural Cancer Prevention Center. Not only are we doing the work locally that Dr. Crosby just spoke about in the Kentucky River District of Eastern Kentucky, we're also involved in broader state and regional and national dissemination efforts. The goal really is to take the products, the cancer control interventions that we develop in Kentucky and disseminate them and adapt them for other populations for the largest public health benefit. So for example, in our last 5-year cycle, we had a DVD, an educational DVD called 123 PAP that was produced by our colleagues over in health communication, Dr. Alicia Cohen and her team, that we are now disseminating across the country. We are partnering with Dr. Glenn Mays and his group, the National Coordinating Center for public health practice-based research networks to distribute this in over 50 health departments in North Carolina and Kentucky. And we've partnered with other groups in West Virginia. We're reaching hundreds of other women outside of Eastern Kentucky with our educational materials and our communication materials, again with the premise to save the most lives. And we have similar plans with the FIT intervention that Dr. Crosby just spoke about. We will partner again with state, regional, and national collaborators to disseminate our intervention to others for, again, the most public health benefit. And then again, as Dr. Capilouto mentioned, with our land grant mission here at UK and our commitment, our own commitment to educating students and the public health workforce and local communities, we partnered with other prevention research centers to write a textbook about rural public health, and that has been used in classrooms here at UK and across the nation and in other communities to learn best practices for intervening and working in rural communities. And then last but not least, we've taken that original investment that CDC gave us 5 years ago, we've leveraged that into almost $2 million worth of additional funding to work on cancer survival in Appalachia with our colleague Dr. Bean Wong in biostatistics, to partner with folks internationally on a cancer surveillance project with the London School of Tropical Medicine and Hygiene, and then also with collaborators in LA and Chicago to look at HPV prevalence among young men. So again, we're active in a lot of different areas, from scholarship and academia to the community-based research that even Sherry's going to talk about. But we're very excited, and I think with the next 5 years of funding, we can continue to make an impact on cancer disparities, not only here in Eastern Kentucky and Appalachian Kentucky, but beyond as well.
Thank you. I appreciate you all having me. I appreciate the RCPC and what they have done in the Eastern Kentucky. Even though I wasn't raised in Eastern Kentucky, I've been down there so long that I sound like I'm one of them. And I'm very passionate about what's going on in Eastern Kentucky, and so this group has made a big difference. I've worked with them on different projects, but this one is especially close to me because I am a colon cancer survivor. Unfortunately, I was too young for screening. I was only 44 when I was diagnosed, and I was told I may live 2 years. The reason why colon cancer is such a killer is because by the time you have symptoms, it's too late usually, and that's what happened to me. But I'm a pretty stubborn person, so I didn't listen to the 2 years diagnosis, and but what really touched me is when I was taking treatment, I would be in rooms with people older than me, as advanced as I was, and they could have prevented what I was going through if they would have done their screenings. And so, you know, we had a meeting once, and the term used was, you know, which colon cancer screening is the best one to take? And it's whichever one somebody will do. And that's why this FIT testing is so important and why it will reach so many people in Eastern Kentucky. As part of the American Cancer Society, we're committed to increasing the colon cancer screening rates, and that's why we have the Community Health Advisory Program to help reach the local people who are more comfortable with their peers and things.
One of our challenges here is to how to translate a lot of our research out into the community, and so I believe that this particular effort, as we just heard described, is really a way to really do that. I think just by the impact of having that capability advanced here and federally funded and supported, that moves us forward in a research agenda. And it really impacts our entire research portfolio, because these types of programs make us even more competitive for other federal funding mechanisms by virtue of having them here. So those are the main ways that I see that it'll help us, aside from just what all impact it's going to have on the community, which I think we could hear very clearly here.